Good morning, I am Dr. Mohammed Attia, Anesthesia Consultant and Clinical Director of Anesthesia Department at Armed Forces Hospital South Region in Saudi Arabia. Actually, we are doing now a scenario for how to give sedation for a patient in the ER coming with shoulder dislocation. We are giving in our hospital sedation for the patients outside the OR, and it is provided by the physician, not anesthetist, as endoscopy and oncology and in the cath lab, in the echo, cardiology, in the radiology departments, in the ER. These sites we are giving sedation for the ASA1 and ASA2 patient by the physician there. We will simulate now with you a patient for conscious sedation. Our aim is moderate sedation only, not deep sedation or light sedation with analgesia for these procedures. Now we have our patient. We will take a history from him. What is your name?
Ahmed Saleh.
Did you have any history of any operations or
No.
You have any diseases like diabetes, hypertension? You have any problems in the chest? You have any asthmatic attacks? Or,
No.
You are taking cigarettes, smoker?
Yes.
Yes. How many cigarettes per day?
1 bucket.
Okay. You have any allergies for any drugs?
No.
Okay. We will do inshallah for you some examination. So please, can you open your mouth? Say ah. Now I am doing for him an empathy test. Okay? Okay, thank you. Take a deep breath. Okay, thank you. You are good. Please, Mr. Ahmed, the last meal, when the last time you eat?
7 hours. 7 hours ago.
7 hours ago. Okay. Now we finished our history and our examination, and he is ready now to sign the consent. This is the consent for sedation. We will let him to sign the consent for sedation. Okay? Please, Mr. Abdurrahman, sign that we will give you sedation. Thank you. Then we will, the orthopedic doctor will sign the consent for the procedure. It must be signed also, the consent of the procedure, by the physician who will do the procedure. If the orthopedic will do, he will, he's the one to take the consent. If, the, for example, the gastroenterology, he's the one who will do endoscopy, he's the one who will sign this consent. Okay. Now we will prepare our patient, and we'll prepare the place that we will give the sedation. The place must have, of course, as you can see, here is the crash car and our monitors and suction and oxygen to connect to the patient. We already, as you can see, we inserted for the patient IV cannula, and we connect our fluids to the cannula. Then we will start to connect already our monitors, the pulse oximeter, as you can see, also the blood pressure and the ECG, and we have our monitor with ECG, blood pressure and pulse oximeter. Also we will connect our BIS machine, bispectral index machine, which will detect the awareness and the level of sedation that we will achieve. As we told before, we are aiming for the moderate sedation. So we will connect now this machine, as you can see. Okay, we already connected our this machine and it is reading now 98 because the patient is still awake. The optimal level is 60, 50 to 60. This is the optimal level. Now we will connect the carbo stream, which will give us the nasal bronch oxygen and will detect our intertidal CO2, which means that the patient is already breathing, and during the procedure we are sure that he is breathing, and this machine is available in most of the sedation site. As you can see now, it is the waves of the intertidal CO2 are coming. So now we are ready to give our medications. Okay, after we prepare the patient and connect our monitors and we insert our IV line and the fluids, so we will now come to the time of medication. The medication is given by the provider and the physician by himself, and the nurse for documentation and following the monitoring, and if the physician needs any help, she will help him. So what is the medication used in our conscious sedation? We can use midazolam, we can use ketamine, we can use propofol and fentanyl. Now we will give our medications and he will document and monitor the patient during the procedure. Now we finish our procedure and the shoulder, alhamdulillah, is returned to the normal position after we give the patient our moderate sedation. Now comes the stage of post-sedation recovery. We must monitor the patient after he finishes the procedure until we are sure that all his hemodynamics are stable and he returned his conscious level to the way that he can be discharged. This usually taking from half an hour to 45 minutes in normal patients. And also don't forget to document the recovery period in the recovery sheet, that it is already present in your pre-sedation and monitoring and recovery sheet in the same paper. So by this we finish our simulation. Thank you very much.